Aidan, you're very welcome to the 15-minute forum.
Thank you very much, Joanne.
So you have an exceptional background in HR, in healthcare, and in public sector. Do you feel that all that experience is now kind of on your shoulders during the crisis that we're currently going through?
Yeah, it certainly assisted and it's helped. I've worked in the health service for a number of years now, and as you know, within Ireland and certainly within other countries, health services are all about managing crises. So you have people that are coming in with crisis situations, and in that context, you yourself become, accustomed to kind of crisis management and so on. So yeah, the experience has certainly helped, and I certainly felt that when this crisis came up, of course I'm still learning like everybody else every day, but there's been a few practices and techniques and experiences that I've been able to draw from in order to effectively help and support this very, very new, unusual and difficult fight.
One of the big requirements for our National Health Service right now is people. And interestingly, on St. Patrick's Day, our National Day of Celebration this year, our Minister for Health and our Taoiseach made a public call, and they asked people who have previously worked in health services in Ireland, who've maybe retired, who maybe switched profession or diaspora abroad, to come home and to be on call for Ireland. What a remarkable call out to your people on St. Patrick's Day, but obviously we are living through a crisis, and so needs must. How have people responded, and how have you leveraged digital and social media to engage with that community?
There was a very heartwarming response to that call. I believe Minister Harris stated that certainly over 50,000 people submitted applications, or they submitted interest or expressions of interest to this call, which is absolutely amazing. Out of those, I think 6,000 people were eligible, which is a phenomenal result, and it really does reflect the wonderful, I suppose, sentiment and wonderful culture that we have here in Irish society, that people are willing to step up and assist and answer to the call, if you like. So the response has been great, but there are many challenges now. How do we process these? How do we process these people fast enough to ensure that they're out on the ground, assisting and fighting the crisis? How do we, make sure that we're vetting them as quickly as possible, ensuring their eligibility criteria and so on? And I know that the HSE has been doing some great work and fantastic work, and has already made some wonderful decisions in doing that, but there's still a bit of work to be done.
It seems that we're all in a phase of forced digital transformation, and because many people at that stage were working from home, has the whole process of recruitment being transformed? I know you've spoken to me previously around digital processes for recruitment, but were they expedited during this crisis, and are they?
Absolutely. So, one of the instructions I would have given to those that I manage would be to clear as much of your diary as possible. I certainly cleared as much as my diary that I possibly could, leaving in obviously the important meetings centered around coronavirus. And the purpose of freeing up the diary was to conduct your Skype interviews, your telephone interviews, and interviewing any way possible without actually experiencing the face-to-face contact that we're all so used to. So yeah, we've seen a massive change, massive trend in terms of recruitment, and I'm interested to see if that will stick, if that will remain following on from the crisis. But certainly recruitment has overnight transformed for the public sector.
Let's talk about social media. It can either be your friend or it can either be your foe. And we've heard Simon Harris, our Minister for Health here in Ireland, and our Taoiseach and our Chief Medical Officer and other professionals saying, please don't go to social media for your information. Please go to trusted sources. Please go to our websites. But I have to say that people are still going to go to social media because it's a fundamental way in which we communicate. How has social media helped you guys in your work?
Social media has been a phenomenal tool that has helped us recruit in particular, which obviously the main priority at the moment is recruitment. And as you said, we need people to respond to this crisis. We need extra people because there's going to be additional patients, more people are going to be sick, additional wards are being opened, new test centres are being opened, and as such we need people to staff these new services. So recruitment has become the #1 priority, and certainly social media has been key in assisting in the recruitment strategy. And for example, we would have saw, out of 300 applications, 203 of those applications came directly from social media advertisements over a period of 3 days. So clearly social media is now the platform for recruitment.
And do you think with more people spending time online, more people spending time on social media, that there's an even bigger responsibility on government agencies and healthcare agencies in particular to raise the bar and to increase the output on social?
Yeah, absolutely. We need to engage. We need to, engage further with social media. I completely agree with you that there's a lot of misinformation circling around social media, and it certainly wouldn't be my area of expertise on how to combat that, but certainly something needs to be done in order to mitigate that that misinformation. I know that Twitter has implemented the system whereby somebody is an official account by having the blue tick. Perhaps something similar could be implemented with posts on critical pieces of news like coronavirus. There could be a blue tick beside that to say this is an official news source agency that's informing you of this particular update. So yeah, changes will need to be made. Public sector will need to engage further with social media a lot more, and I believe they'll do so when they feel that it's probably in a safer, more structured environment. And at the moment, as you can probably imagine, being a social media expert, it can be at times chaotic.
I completely understand, and one of the concepts that I've been thinking about recently is messaging fatigue versus messaging absorption, and at what stage do the public become tired of the same message, and at what stage do they take it on and become advocates? But one thing I've noticed, Aidan, is actually your staff, your nurses and your doctors using social media to tell their story from their perspective, and they're advocating the same guidance as our government and chief medical officer are, but they're telling us a different story and from the front line. How do you respond to that as somebody who works in HR and staff using social media to have a voice?
I think that it's absolutely crucial that people within the public sector, we are taxpayer funded professionals. We need to be accessible to the public. We need to be transparent. We need to be giving the information that, for example, I'm giving you today in a personal capacity, on trends and what's happening in terms of the coronavirus within the public sector. We've seen doctors like Dr. Gabrielle Colleran, who is a very active Twitter user. She was named one of the top Twitter users within the HSE recently, alongside Rosari Mannion. And with Gabrielle, for example, she would regularly update her Twitter and inform the public of requirements that are needed within the health service. And her voice, her opinion, is so important and so much more important than reading what a columnist might write, a health columnist who may never have worked within the health service before, telling us what changes need to be made. Someone who's actually there on the ground, dealing with patients, coming out onto Twitter and saying, hey, here's what we need to do in order to fix the system. That's going to have far more impact. And that's why we're seeing a lot more engagement with, public sector individuals on social media. And we're also seeing as well other services transformed, like HSE's HR team was transformed by Rosario Mannion. She would have led, a communication strategy, a people's change strategy, which was championed and promoted through and alongside the HSE communications team, and the HSE HR Twitter was set up and was run by one of HSE's wonderful employees, Lorraine Smith, who basically saw positivity promoted about our health service, and the changes that were happening within our health service, particularly within HR for that particular account. And people got a real sense then of what's actually going on in their public services, and they did so through social media. So it's been a huge tool to offer transparency.
And what would you say about, the role of a health service versus the role of a media? Because we've seen here in Ireland, and again, I'm looking on it from my perspective, which is kind of analysing how public sector communicate with the public, but we have our national broadcaster and national media stepping in and taking a lot of the communications kind of workload. Do you think that equally our national health services and other public sector bodies should have as much output as journalists and media have? Because you made that point. You have journalists telling a story. Obviously, they have a huge public interest role, but you have another side to the story as well. And I just wonder where the balance is from your perspective.
Journalists are going to be always critical and central in our society in order to, shine light on, issues that occur in our society and to bring us up to speed on what's happening globally, nationally, locally. So journalists will always be so important. Equally so will health service professionals. And I just think that the very small issue in Ireland is that they're probably not connected enough, health service workers and journalists, and we probably need to see more connectivity between the two, more collaboration between the two, more joint communication between the two, and then the public service messaging may possibly become far more effective.
Every day that we turn on the news, there's never a day previous to this pandemic arriving at our doors. There was rarely a day where there wasn't a news story, and usually not a positive news story, about our National Health Service. Do you think that there will be a shift in public opinion and in media opinion around our health service after we come out of COVID-19?
Yes, and I can see it happening already. I live in the city centre, and I know in different areas this may have occurred, but last night at 8 p.m. People came out onto their balconies and out onto the street and clapped for healthcare workers and those working to support the health service. I said it earlier in a video that I made today. I'm not just talking about people that are doctors and nurses that are doing a wonderful, wonderful job in fighting this crisis, but I'm talking about the people that are, going in and looking after maintenance of hospitals, our caterers, the people that are doing administration and management. All of these people are working really, really hard to fight this crisis, and it was great to see the public come out and show support of those people by giving a round of applause effectively. I've also noticed, and I've also seen that, we have seen efforts come from the HSE, for example. They have set up a People of the HSE account, which shows, on a regular basis, different, you know, the lives of different public sector health service workers, what they do, because sometimes the public may not fully understand, or the transparency may not be there for them to understand the really, really hard work that they're doing, and the recognition that they deserve. So I think we will see a shift. I think we will definitely, after COVID-19 is gone and finished with, I think there will be more appreciation for our public health service, but certainly there will still be anger, and there will still be upset around things like waiting lists, you know, the speed in which our health service operates. All of these issues are issues that still need to be fixed, and certainly, you know, some of these issues are coming under more pressure because of this crisis, but I think people appreciate that everybody is doing their best.
So Aidan, I need to ask you, all of us are staying at home, taking the guidance of Mr. Tony Holohan, our Chief Medical Officer here in Ireland. How are you coping with working from home? And I know that you also live alone. I mean, how are you adapting to this new way of life for the foreseeable future?
I'll be very honest, it's been very difficult. It's been very hard. You know, there's certain things that you like to do when, you know, when you go home or when you get home from work, they suddenly become something that you're doing far more regularly because you're at home longer. So you have to try and think of new things to diversify what you're doing day to day at home. And obviously it's so important to take advantage of the allowances to go outside and to do your exercise, and factor that into your daily life, because if you don't, and you do go into complete isolation, it's going to be detrimental to your mental health. So please do go out and exercise. That's what I've had to do. I've had to make sure that I'm bringing my dog for a walk, and I've had to make sure that I'm, you know, not doing the same repetitive things every day, and that I'm diversifying what I'm doing at home, and in order to adapt to this new way of life.
And I can't let you go without mentioning your HR Rising Stars Award, and it's not the first award that you've been nominated with or that you've actually received. You have been kind of putting your mark on HR and healthcare and digital transformation for some time. Tell us about this latest nomination.
I'm delighted to be nominated for HR Rising Star of the Year Award for 2020. It's a great honor. I'm really, really humbled. I've obviously, you know, I've got into a lot of trouble in the past for rocking the boat within the public service on new changes and new initiatives that have been needed. But they've always been in, you know, in the public's interest, and they've always been in good faith. And the bravery, I think, and the, you know, the ability to say, hold on a second, and challenge some of the status quo and the existing practices that exist, have enabled me to implement changes that, you know, have very humblingly, you know, resulted in nomination for various different awards. I also know that you're aware that I led the teams in Beaumont Hospital that were responsible for winning the Most Effective Recruitment and Retention Strategy Award for 2018, along with the Best Public Sector HR Initiative Award for our work to bring nurse vacancy levels down to the lowest seen in 15 years, and along with other items aligned to our HR strategy. And, you know, I couldn't have done that without my colleague, the HR director, Patricia Owens. She was very much supportive of the strategy. She was there with me. She was a big part of it. And, you know, she had been in the public sector for some time, but I was a new person coming in, and she's shown huge amount support. And I think my advice to public sector leaders is, when you do get, you know, somebody new coming into the public sector, somebody maybe with some fresh ideas, you know, don't block them out, don't ignore them, listen to those people, consider them, see how they'll fit into your service, take a risk, and see, will that positively impact your service.
Well, I think right now, Aidan, that your sentiment is spot on, because everybody in every country affected by COVID-19 right now has had to think outside the box, has had to prepare a roadmap that we didn't have, and has had to listen to other people with new ideas and other opinions. So I do believe that minds have been opened, mindsets have been shifted, and cultures will be completely disrupted in healthcare, but in all areas of public sector after this. I want to thank you and all your colleagues and staff in healthcare in Ireland for serving us while we stay at home. It's the least that we can do. And thank you so much for joining me on the Public Sector Marketing Show, and continued success, and stay safe.
Thank you, Joanne.